Health is in focus as health policy experts debate the best way to control healthcare costs. News Channel 11's Jackie DeFusco asked health policy experts to weigh in on the use of COPAs across the country. She reports tonight from our nation's capital.
In a nationwide conversation, our region's healthcare is at the center. The question is whether healthcare regulation or competition is the best way to protect patients. I'm Jackie DeFusco, and I traveled to Washington, D.C. to put Ballot Health's COPA in context.
This matters because we want patients to have access to high-quality, affordable health care. The question is, what is the best way to get there?
It's a tension between theories. The Federal Trade Commission has long defended healthcare competition, but when it comes to the courts, they haven't always won.
There was a period where the FTC lost 7 cases in a row. They brought these cases to prevent mergers at the front end, so they didn't have a lot of documentation about what would happen.
Today, experts say cross-market hospital mergers, most unregulated, are curbing competition across the country.
Which now economists have demonstrated have market power to raise prices, and yet nobody's doing a thing about it.
Meanwhile, academics say hospital mergers are causing U.S. healthcare costs to skyrocket.
The insurer has to pay more for the hospital or the physician service, hence higher prices for us when we pay our premiums.
Recent studies suggest market concentration may also have a negative impact on wage growth for some hospital employees.
The fewer separate employers you have competing for that workforce, the less you have employers driving up pay in order to attract workers.
Amid these problems come certificates of public advantage, a pitch pushed by the Hospital Association as a way for states to control costs and reduce unnecessary duplication of services, often in rural regions.
If markets aren't working very well elsewhere, why not have a state then put strings attached to a merger?
Experts call it an imperfect regulatory fix.
They're really a Band-Aid, and they're a Band-Aid on the most problematic mergers that there are.
Since the 1990s, a handful of state legislators and attorneys generals have opted to trade antitrust scrutiny for active state oversight, a price experts say many for-profit systems aren't willing to pay.
There are very few of these COPAs that exist out there because the serious regulation requires basically a regulatory colonoscopy of these hospitals, and that's a pretty painful process.
In other words, COPAs come with commitments, insurance rate regulations, price caps, a promise to maintain rural access, and to reinvest savings towards improving population health.
The only real way that you can justify them intellectually, in my opinion, it's that the hospitals are going to spend the money on worthy purposes.
Concerns remain, and just as many questions. Are COPAs the answer, or just another barrier to higher quality, lower costs, improved access, and innovation?
I don't see this in any way as a black and white issue, that they're obviously always bad or they're obviously always good. The details really matter.
The Federal Trade Commission will be collecting public comment on your experiences with COPAs on their website until July 31st. In Washington, Jackie DeFusco, News Channel 11, in your corner.
Now, that was the second story in Jackie's 3-part series on the Federal Trade Commission's recent workshop. Join us tomorrow at 6 as she continues her coverage on COPAs from our nation's capital.